Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're happy you could join us. We're also pleased to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to the media who are joining us this afternoon, and a hello again to some of you who are able to join us this morning in Mount Bridges. We're glad that you could join us. If you do have questions you would like to submit for either Mayor Holder or Dr. Mackie, just click on the question icon here on Microsoft Teams, and if you could indicate your name and your media outlet, as well as who your question is for, when you do submit those questions. A welcome to those tuning in on Rogers Television this afternoon, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio AM 980 CFPL, and those who are tuning in on the CTV London website. Let's begin with our opening remarks this afternoon, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. Earlier this week at my State of the City address, I spoke a lot about credible hope and reasons for optimism as our experience with the pandemic in London Middlesex is now 384 days and counting. We have more examples of credible hope just this week, and that's to say nothing of our consistently lower case counts, now among the lowest of any medium to large size city in Ontario. Just yesterday, the locations of the third and fourth COVID-19 vaccination clinics for our region were announced: North London Optimist Community Centre and Earl Nichols Arena. This is part of an effort that, once adequate supplies available, will see up to 3,000 right across our region. And with the staffing and locations now secured, all we need now is a consistent supply of vaccine. The second example of credible hope was earlier this morning, where an essential caregiver to her elderly parents in long-term care became the first individual to be vaccinated at the vaccination clinic in Mount Bridges. As I said in my State of the City address, there's more of this behind us than lays before us. Thanks to vaccines, combined with ongoing advancement in treatments and rapid testing, and the leadership of the Middlesex-London Health Unit, we know how this ends, and we know approximately when. So more than anything else, we know with certainty that it does have an end, likely not with a moment of triumph that we'll all remember, but rather a slow whimper, albeit one we won't soon forget. As we work towards that point, we need to remain focused and vigilant. Just because our case counts are lower doesn't mean COVID has gone away. We went from close to 200 cases a day last month down to single digits this month. It could just easily go the other way if we lose our resolve. So let's continue to do what we're doing, keeping ourselves and our family healthy, along with our fellow Londoners. It's all within our power to do that, and I congratulate Londoners and those in Middlesex County for the leadership that they've shown when it matters most. And my heartfelt thanks. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. And as Dan said, so appreciate everyone coming out to the Mount Bridges opening of the vaccine clinic there. That new clinic will offer much needed supply in terms of the vaccination process, and that capacity will really help us meet our vaccine targets. We did announce this morning that we had vaccinated over 28,000 people in the region. I can now confirm that we're over 29,000 people in the region. So that really is moving apace. And a huge thanks to our partners at London Health Science Centre, Huron-Perth Public Health, and Southwestern Public Health, as well as Middlesex-London Paramedic Service. We're also seeing the municipalities really step up. As we announced yesterday, 2 new clinics at North London Optimist Centre and Nichols Arena that will be opening ideally within the next few weeks, all depending on vaccine supply. And our municipal partners have really stepped up to help prepare that. So thanks very much to the City of London for everything they've done preparing those sites. We will have all long-term care homes vaccinated by the end of this week. That's 2 doses, so everyone in long-term care homes will have been offered, and almost all have received 2 doses in long-term care, and high-risk retirement homes, and all retirement homes will be completed next week. So that is all very positive. Along with those changes, we're also seeing the death count decline. So case counts have been low this week, just 13 today, and single digits for most of this week. but we haven't seen a death since the 12th of February. That was reported on the 13th of February. And so that's now 6 days of no fatalities. So that's a very big positive. It is a combined effort, really. You're seeing two things impacting the reduced mortality. One, less disease spread. People really are taking public health measures seriously, but also the vaccine being in the arms of those that are most vulnerable in long-term care and retirement homes really helps to curb the death count as well. So that's all fairly good news. Dan, I'll pause there. Happy to take any questions.
Thank you, Dr. Mackie. Thank you, Mayor Holder. Let's get to the questions right away then. Jen Beeman is first in line today. Dr. Mackie, of recent cases, how many are linked to close contact, outbreaks, travel, or unknown origin?
Yeah, I appreciate the question, Jennifer. Let me start with travel. We did have the two recent variants of concern that were associated with travel. Other than that, we aren't seeing an enormous amount of travel, so we aren't seeing an enormous number of cases that are linked to travel. In terms of outbreaks and close contacts, it really is split and varies, depending on how much testing we're doing associated with an outbreak. But both are in the range of a third to a half, depending on the day. And that, again, and still a number of cases that are unlinked to previous cases or to outbreaks. The outbreak number varies in particular. When we find a case in a facility, for example, we test all of the staff and residents in that facility, and we often uncover more cases there. So that pushes that percentage up. We're not seeing a huge shift from what we have over the last few weeks in terms of where cases are coming from.
Thank you, Dr. Mackie. Follow-up question from Jennifer. Dr. Mackie, how would you characterize the level of community transmission in the London area right now?
Yeah, so our perspective on this question really has changed. Last summer, if you were to say we have cases between 5 and 13 per day over a week, I would have said that was pretty high spread. It was certainly much higher than we were seeing on some days last summer. Nowadays, it looks pretty reasonable compared to where we've been over December and January. So, the low, medium, highs is pretty arbitrary description. What we do know is we've come down significantly off the peaks in December and January, and of course we want to keep seeing those numbers go down lower.
And a quick follow-up from Jennifer. Dr. Mackie, are you expecting cases to rise in the coming weeks now that the shutdown is over?
So the shutdown being over will be a factor. The other major factor is the variants of concern. You're seeing more and more data that the variants of concern have been spreading more and more each week, and even during the period of lockdown. So even while lockdown was occurring, we were seeing more cases. While the overall pandemic was really shrinking, the number of cases of variants of concern was increasing over that same time period. So that's really what we're most concerned about. The variants of concern seem to require less exposure, so shorter durations without a mask of face-to-face contact being adequate to spread the virus. And we've been fortunate only to document 6 cases here in this region so far, and 4 of those from December, but we do expect that number to increase. And if you look to places like Simcoe, Muskoka, for example, they've seen real explosions of their case counts related to the variants of concern. And there's no reason to believe that that would never happen here. Well, the hope is that we get enough vaccines into arms as quickly as possible that we can slow the spread of variants of concern and prevent deaths.
Thank you, Dr. Mackie. And you mentioned the 6 cases of variants of concern. And I think we talked about that earlier this week, that 2 of those seem to have been in people who have traveled recently. There was one last quick question. Do we know if any of those cases are active? Any of those 6 variants of concern cases?
Yeah, the last 2 cases would be just near the end of their active case period. The issue there is that it does take at least, the screening process for the variants of concern is relatively quick. Once the lab results are back, which takes, about 2 days, the individual the samples get tested for variants of concern, which turns around in about a day, but then after that, in terms of the whole genome sequencing, that takes another week. So once diagnosed as a variant of concern, you're probably in the range of a week through your quarantine period. So those quarantine periods are isolation periods are ending this week and the next week.
All right, thank you very much. On to our next question. Wendy Spence is joining us this afternoon from the Dorchester Signpost. Dr. Mackie, Wendy asks, do you know if there are any plans to do mobile vaccination clinics in some of the outlying areas of Middlesex County in the future when the general public is able to get vaccinated?
Yes, so thanks very much for the question, Wendy. Certainly we have been mobile. The vaccine has been in every long-term care, all high-risk retirement homes, and will be in all retirement homes by the end of next week. Do we envision continuing on with those mobile clinics? Absolutely, in various forms. The mobile clinics are most useful when you've got a population that is not mobile. So going to congregate living settings, which is a general term for long-term care, retirement home, and other seniors dwellings, that will be something we continue to do. Outside of long-term care and retirement home, there are many dwellings that cater to seniors for various reasons, and we'll certainly continue the mobile campaign in those settings. For those that are able to travel to get their vaccine, the mass immunization model is much more efficient in terms of staff time and much safer in terms of securing the vaccine supply. There are a number of things that can go wrong with a mobile clinic, but the biggest one is that we don't want to end up with doses at the end of a clinic that can't be used. The vaccine, once it is reconstituted and thawed, it's not really supposed to be moved any further. So, by the time the vaccines get out to those mobile sites, they are thawed. We don't have the capacity to produce liquid nitrogen here, which means the vaccines are thawed by the time they get to those mobile sites, and they can't really be moved beyond that. So there's a risk of vaccine loss. And then the mobile sites just aren't as efficient in terms of the time it takes to vaccinate each patient. In the clinics, we can get in the range of 5 to 7 minutes per patient. In the mobile sites, it's usually much higher than that because of the setup time.
So lots of considerations there. Beyond just vaccine supply, it's a lot more involved than it might otherwise appear. All right, let's move on to our next question. This one comes to us from Steve Young at CTV London and News Talk 1290 CJBK. Dr. Mackie, what is the current situation with the outbreak at EMDC? Do we know how many staff and inmates currently have COVID-19?
Yeah, so things have really calmed down at EMDC. Very impressed with how the facility has been able to manage that outbreak. We haven't seen a lot of cases recently there.
Thank you very much. We are getting down to the last question, so if you've been waiting, if you've got a question that you want to ask, now would be the time to get it in. And if you could, that would be great. Jennifer Beeman is back with another question, Dr. Mackie. Why are our cases so low right now?
Yeah, I mean, the cases are so low right now because people have been staying home and avoiding contact. We have data across Ontario. We don't have it at the local level, but no reason to suspect it'd be different here. That looks at mobility, and it uses data like the Google data on people using their Google Maps to track their travel. And that sort of data has shown a major decline in the amount of mobility in Ontario. And we know when people aren't mobile, that means they're less likely having physical contact face-to-face with others. And that's what stops the spread of this illness. So we are starting to see that coming up across the province, and hopefully not to levels where we see, the December, January rates of illness spreading.
Thank you very much, Dr. Mackie. That brings us to the end of our questions for this afternoon. We thank you very much for them. Dr. Mackie, Mayor Holder, thank you both for your time again, for sharing your thoughts and your information with everyone this afternoon. It is very much appreciated. We will be back with our next virtual media briefing next Monday at 2 p.m. So we hope you will join us then. Between now and next Monday, have a great weekend. Take care of each other, and we will see you again soon. So long for now.